very important risk factors is undernutrition, malnutrition, and because of the effect that has on the body's immune system. So the reason why tuberculosis is often called a disease of poverty is because it's associated with undernutrition, number one, and secondly with overcrowding, and so that you have more of the transmission of disease can take place when there are many people sharing a small room. And then there are other risk factors like cigarette smoking, indoor air pollution, which also tend to occur more in the poorer communities, especially people are using fuel for cooking indoors. The other major risk factors for TB are HIV infection, it's a very big risk factor, and diabetes mellitus, which is increasing now in India, and of course it's common both amongst the poor and the affluent classes. But certainly if you look at the worldwide risk factors, and particularly if you look at India, undernutrition is the most important, commonest risk factor for tuberculosis. So definitely that needs to be acknowledged and tackled at the same time. Adjunctive therapy for tuberculosis, there is a role. And we talked about nutrition, for example.
Yes.
But there are, in other systems of medicine, there could be herbal medicines or other kinds of compounds which are immunomodulating, that can somehow strengthen the immune system. There may be also some compounds which could potentiate the effect of drugs. For example, we know that piperine, which comes from pepper, potentiates the effect of rifampicin by enhancing the absorption and by blocking some of the efflux pumps. So I think there's a role for exploring the adjunct treatment for TB using maybe anything that comes from other systems of medicine, but it needs to be tested, and the evidence needs to be created in a very controlled setting, in the setting of a clinical trial, because without that these claims can never be substantiated. So they have to be proved either this way or that way. So I think we should have an open mind when people from other systems of medicine, they claim to have products, but most of them, I think, they only talk about an adjunctive treatment for TB. They don't talk about replacing the TB drugs. So wherever there is a potential, again, I think we should collaborate with those particular physicians or the healers, and look at whether there's any. First of all, look at what evidence there is. What are they able to provide us in terms of their clinical experience? Then look at the chemistry and so on, and then ultimately it has to be shown in a clinical trial.
Yes, really, yes. It should be proved.